Good morning. It's June 4th, 2021. Welcome to the Civic Caucus Friday interview. The Civic Caucus is dedicated to nonpartisan debate and discussion of issues important to Minnesota. I'm Janice Clay, Chair, here with the Civic Caucus interview group. I want to express our deep thanks to Tim Black. Tim Black is the Director of Consulting at Whitebird Clinic in Eugene, Oregon. With a background in runaway and homeless youth, harm reduction, and street outreach, he began working for the CAHOOTS program as a crisis intervention worker in 2010. We're here today to hear about the CAHOOTS model of behavioral health first response, an innovative and successful program for some 30 years in Eugene, Oregon. Thank you very much, Tim, and let's get started.
All right, thank you, Janice, and thank you all for joining for this conversation this morning. I wanted to start off by just kind of talking about Whitebird Clinic and the CAHOOTS program, and kind of getting a good overview of how we got to where we are and what it is that we do today. So really kind of starting off talking about the history of CAHOOTS, we have to really go back to the founding of Whitebird Clinic 20 years prior. In the late 60s, there were a group of providers in the Eugene community who were really seeing how kind of the shadow of the summer of love was affecting our small, relatively suburban college town here on the I-5 corridor. We're almost exactly halfway between San Francisco and the Canadian border, and so we were a part of that whole big kind of West Coast migration. We were seeing how deinstitutionalization was bringing folks out of those systems of care and into the community, and where the community wasn't ready to receive and support these folks in that transition process. And so our founders wanted to find ways to do something different, start to fill in some of those cracks within the system that we were already starting to see. One of our founders, Frank Lemon, was known in his neighborhood as the porch to go to when you were having a hard time. So he already really was kind of plugged in. He was who everyone came to in the campus area. Go talk to Frank if you're not sure what to do. Dennis Eckinger was a psychiatrist who just wanted something for the folks in the community that he was trying to treat that just weren't receiving adequate care. And so they went down to San Francisco and spent time with the Haight-Ashbury Free Clinic, providing care and working with the founders, really learning from them. And Dr. Brown actually ended up helping advise a lot of the process at Whitebird for the first couple of years that we got started. After spending time in the Bay Area, we went up to Portland and toured Outside In, learned a lot from them up there about what was happening in the big city in Oregon. And we brought that down here to Eugene, and we created what we called the Whitebird Socio-Medical Aid Station. Before we even had a brick and mortar location to have folks come to when they were in need of services, we had a crisis line that we could operate. And so it started ringing into our founder's living room, and it's the same local phone number that you call today, 52 years later, when you're in crisis and want to talk to Whitebird. And as soon as that phone started ringing, we started to hear situations where the phone wasn't the right medium to have an intervention. The person in crisis really needed someone who could meet them where they were at, someone who could come to them. And really recognizing that there wasn't another option other than sending police at that time, we activated what we called the Bummer Squad. The Bummer Squad was the group who, when you were having a bummer of a night, if you were, experimenting with psychedelics and having a bad trip, you could call, and volunteers from Whitebird would get into their personal vehicles and come out to you and work with you with the intention of really trying to provide care where you were in the community and provide some, support and stabilization so you didn't have to go to the hospital, right? Maybe it's, let's drink some water, let's have your neighbor come over and hang out with you for a couple of hours, or maybe, hey, you do need to be around some other folks right now. Why don't you come with us to Whitebird Clinic instead of, let's take you to the hospital where you're going to be locked up for 3 days and then turned out, feeling the after effects of the Thorazine that you were given in the hospital. So we started to provide care in that way, really providing this community-based crisis response. For 20 years, the community of Eugene really grew to depend on the Bummer Squad. Law enforcement and other public safety partners were more frequently bringing folks in crisis to Whitebird Clinic rather than taking them to the hospital or taking them to jail. And in fact, in 1974, there was a documentary about Whitebird that was done by the University of Oregon. And the very first scene in that documentary is a patrol officer who was trained as a crisis worker at Whitebird before he went to go work for the Eugene Police Department, actually taking somebody out of the back of the squad car in handcuffs, handing them over to providers at Whitebird Clinic with this endorsement, this is where you need to be. These folks can help you out. So going back to the early 70s, right, we have law enforcement encountering folks in crisis and bringing them to Whitebird instead of taking them to the hospital or jail. And so we had a tremendous amount of privilege, right, that came with the community trust that we had built over 20 years, and the fact that public safety really looked to us as a viable partner for the kinds of diversion that we want to see even now today, you know, kind of as that big end goal. And so it really started to seem like a natural fit for the city of Eugene to find ways to work with Whitebird Clinic. A community policing grant became available in 1988. And for the next year, we engaged in a lot of planning with the Eugene Police Department, the Eugene City Manager, and my predecessors at Whitebird Clinic to develop this program that was really taking what the Bummer Squad was doing, giving it formal structure, giving it funding, you know, giving it access to the police communication system so that we could start to take calls from them so that officers wouldn't be responding to those non-criminal situations. And that culminated in the 4th of July in 1989 with the first official CAHOOTS shift. We've been running continuously since then. When we started, it was 40 hours a week. It was a Tuesday through Saturday program. And every time we've expanded, you know, every moment where we have really increased services, either putting more vans on the road, more hours of the day in Eugene, or even branching out into the city of Springfield, which is just across the river and makes up the rest of our metro area, we've always looked to the community to really inform when and how, you know, those expansions of service are going to happen. Something that I really do want to highlight that's not really about Whitebird or CAHOOTS, but is important to understand kind of the climate of Eugene, is that there were several other grassroots organizations that got started that same year that Whitebird Clinic did, who've become these kind of public institutions. There's a performing arts center. There's our Saturday market. The Oregon Country Fair, which is this kind of internationally known festival that takes place in the woods outside of Eugene here most years that there's not a pandemic happening. Those systems all kind of were you know, those organizations were all founded by a lot of the same folks and have really kind of become, you know, pillars of what folks really think about when they think about the Eugene area. And so, you know, we really, you know, are grateful, you know, to be standing in a forest with so many other tall trees, you know, relatively speaking. At the time that we really took this thing from the Bummer Squad to CAHOOTS, some of the barriers that we faced were really around, you know, the limited resources of our organization and the conflict of cultures between having folks who generally identified as part of the counterculture, right? You know, there was an article about Whitebird Clinic at one point that kind of described how it's hard to tell the difference between the patients and the providers because we were of, you know, very similar minds. And so for the hippies to be in CAHOOTS with the cops was this very novel kind of idea. There was a lot of, you know, nervousness that our responders for CAHOOTS might get arrested if some of their, you know, extracurriculars were made known to law enforcement. And law enforcement was really cautious about working with folks that they had seen, you know, on the other side of the picket line at anti-war protests, you know, related to Vietnam. And so there was, you know, it was kind of like, all right, let's try this thing. Let's see how it works. And it turned out to be a great fit. Patrol officers were really grateful that they weren't responding to these calls for service that weren't about crimes in progress. The fire department was able to reduce how often they were going out for non-emergency medical situations. You know, we had this model that we had really developed over time of having a medic and a crisis worker go out as part of the response. And that was really informed by our desire to maintain humanistic interventions and treat everybody as a whole person, you know, understand that there is no clear delineation between mental health and physical health, and that our responses needed to, you know, be informed by that. And so, you know, we really had a direct impact right away in the public safety system. When we were getting this thing off the ground, we talked about whether we should have a separate number that people could call and, you know, a dispatch kind of like a taxi would have, or if we should be within the public safety system. The intention around having us become part of the public safety communication system was really recognizing that we would have a larger impact if police, fire, and EMS could just call for CAHOOTS directly rather than trying to work a circuitous system and wait, you know, kind of like you do if you have to get a tow truck out for public safety or, you know, even that taxi. It meant that we would be able to collaborate on responses with more traditional partners in public safety. And it really meant that down the road, you know, with the University of Oregon, folks coming from all over to come to Ducks games, that there wasn't a separate number that people had to look up, remember to try and call if they were in crisis or they observed a situation where CAHOOTS could be of support. You know, really recognizing that so many folks in our communities across the country have that itchy, kind of trigger finger on the phone and want to dial 911 every time something looks wrong. And so by being accessible through 911, any situation, where we could be of support that was coming through that public safety system could be directly connected to us. And so, the question of who makes the decisions around what happens with the 911 call falls to dispatch. There is collaboration with CAHOOTS representatives, both responders in the field on shift, but then also administrators, after the fact, coming in and working with dispatch whenever there are, miscommunications or issues that we need to work on together. So, we've been really fortunate to really be able to have such a productive relationship with our comms team here in Eugene. And it's really what's made the difference. As we move forward, we are really recognizing, though, that it requires a lot of privilege to be able to call 911, to call the non-emergency public safety line in order to request CAHOOTS. There are folks within our community who feel like that is just unsafe and, for whom it's a barrier. And we didn't do a good job of reaching out to them in the past. We're doing a better job now. And out of that direct collaboration, we're recognizing the need that we have for a point of access that is more separated from traditional public safety resources. And so as we look at 988 rolling out as a nationwide crisis number over the next year, we really expect to see CAHOOTS become primarily accessed through that 988 number, with some sort of mechanism for those calls that were traditionally coming through 911 and the non-emergency public safety system to still come to us too. So we are in a bit of I think a point of flux when it comes to how folks are going to be calling to request CAHOOTS services. Every response that we do, our teams are unarmed. We don't carry pepper spray, we don't carry a taser, no guns, no vests. And to be honest, we've never had a serious staff injury as a result of patient contact. There are occasional scuffles, right? We are working generally with folks who have been told no all day, all week long. You can't be here. You can't sleep here. We don't want you on this block. And so it's understandable that when you've been disempowered on a daily, on an hourly basis, when you're being pushed to the margins and told that you shouldn't be here, or that you are less than others simply because of your socioeconomic standing, it's understandable that when somebody is feeling that way and they encounter somebody who is in a position of power and authority, that there may be some potential tension. And so our obligation is to really recognize that power differential and to work in ways that can verbally de-escalate the situation and allow us to build the mutual trust that we need in order to work together. And so, by taking the approaches that we have through verbal de-escalation, by not wearing uniforms that look like police, by driving vehicles that don't resemble other traditional public safety apparatus, we can send this really clear message that we are not those same resources that have arrested you or, may have killed a loved one in the past, that this is a different kind of response. Because we're part of Whitebird Clinic and not another city agency, we have a big Whitebird logo, on our shirts. And so if you're waking up and you're still rubbing the sleep out of your eyes because we came to check on you in the park, the first thing you see is this Whitebird logo. And if you have accessed services in the community for any length of time, seeing that Whitebird logo is an indication that this is going to be a safe interaction for you. So we really do a lot in just how we approach our situations, and how we carry ourselves, that accomplishes a lot of the de-escalation that we need to. But we do recognize that there are times where we are going to need to call in, police support. And so we have the occasional time. It comes out to an average about once a day where we're calling in police to help us with a situation that's just a little bit outside of the scope of what we can manage. And those generally fall into two categories: either that physical aggression, where there are direct threats of harm to self and others in the community. So it could be, somebody swinging punches. It could be somebody who's saying that, I'm gonna kill myself when you leave, right? And they're not willing to find that contract for safety with us. And so that's where we do need to engage police support. The other situation is if somebody is so heavily intoxicated that they're unsafe to remain in the community, and we need help doing an involuntary admit for detox and sobering. The frequency of those situations is low. In 2019, within the city of Eugene, CAHOOTS teams responded to 18,000 calls for service. We did 15,000 of those without other public safety systems being involved in the responses, and only had to call for police cover 311 times. You compare that to about 3,000 of our calls for service where it was police, fire, and EMS who got out on scene first and said, oops, no, this is a call for CAHOOTS. Let's get them out here to help instead. And I think one other thing that I can do to really kind of quantify where we fit into the public safety landscape is those 18,000 calls for service that we responded to just in the city of Eugene were out of the 105,000 that came through the public safety dispatch system by the public. So that means really, almost 18% of the overall call volume handled by communications in our community ultimately went to CAHOOTS for a response. So it's we're taking a huge swath of the calls. In the city of Springfield, just across the river, there's another 2,000 to 4,000 calls that we take on average on an annual basis. And so when you blow that out, for a metro area population of 235,000 folks, we're taking well over 20,000 calls for service a year. So that's 1 in 10 people in our community per capita are going to have an interaction with CAHOOTS at some point over the course of a year. After we talk with somebody out in the community, there's not a lot that CAHOOTS directly can do for follow-up. We don't within our department have case management built in because we're first responders. And we are responding to calls from dispatch. We can't go out and do that. Hey, it's been 30, 60, 90, 120 days. We're here to do your quarterly check. How are you doing? Are you satisfied with services? We're just not in a position to do that, right? The ambulance doesn't come out and ask you how your leg healed after they pick you up and take you to the hospital when you got hit by a car. And so as first responders, that's not our place. But Whitebird Clinic at large is a federally qualified health center with over a dozen programs that are all oriented around empowering folks to, address issues related to housing, mental health, addiction, medical and dental issues. And so we can make a lot of referrals to other Whitebird services. If we have somebody that we're encountering who's in an encampment and needs help getting an ID, lost their social security card, wants to get on a housing wait list, we can call Whitebird Case Management and say, hey, Johnny usually wears a red hat. He's been hanging out at the camp at First in Washington and said that, he plans to be here for a couple more days unless there's a sweep. So you've got about a 2-day window to kind of go out and check on Johnny. Again, red hat, First in Washington camp. And case management says, hey, great, thanks. And then they send a peer support person with a van out there, checks in with Johnny, the next morning, gets them set up with some appointments, maybe gives them a ride to go take a shower and then drops them off at the soup kitchen. There's a lot that other Whitebird services can do. And because we're part of the same nonprofit, it's really, the same clinic, we're able to do those direct referrals with a lot of ease. Generally speaking, CAHOOTS and our other crisis services are the front door really for accessing a lot of the other resources that we have. And right now, I guess I do want to take a moment to really celebrate some of the other work being done at Whitebird Clinic. We're running the county's vaccine, one of the county's primary vaccine sites. And we've been doing so for, much of this pandemic. And we're even, afforded the opportunity for a visit from the first gentleman, earlier this year, the second gentleman earlier this year to really, look at what we were doing as part of that, that effort to address public health in our community. And I'm just so proud of that I always take a moment to recognize that work being done. The final thing that I think would really be important to recognize is, this question around what have we done to make a difference in Eugene's crime rate and, with regards to police violence. When it comes to the difference in the crime rate, I asked the chief of police this. I asked the crime analysis staff this at Eugene Police Department. They just laughed at me. It's been 32 years that CAHOOTS has been operating in our community. We don't even have digital records that go back that far. Our population was drastically smaller, in the 80s, as opposed to what we have today. And so they've just really been clear that it is just impossible for them to do a compare and contrast at this point because the program has been operating for so long. But what we can really point to is the fact that for every time that CAHOOTS is going out to talk to somebody, right, we are preventing, we are eliminating an officer engagement with that person. So every response that we have is one fewer encounter with a police officer, right? Because CAHOOTS is responding to so many issues that are stemming from quality of life, if we are having that response instead of police, then that individual is much less likely to end up with a misdemeanor charge, right? They're much less likely to end up with a court date and a ticket that they're not going to be able to manage and take care of, which then leads to a bench warrant and more criminal legal involvement. And so there is a real, I think, direct line that we can draw to show how we are reducing the potential for folks to become more involved with the criminal legal system. And to that extent, we are working to identify evaluators that can help us, really kind of better quantify that. And, I think it would be remiss if I didn't recognize that there still has been, profound incidents of police violence within our community. since CAHOOTS has come in. Just in the last 6 years, within the city of Eugene, we've had 4 fatal police shootings. Brian Babb, Elaborio Rodriguez, and Charles Landeros are 3 who were in crisis when they were killed by police. In the city of Springfield, where we've been operating since 2015, Stacy Kenny was killed by Sergeant Rick Lewis. Stacy Kenny's family, for the year leading up to that fatal shooting, had been reaching out to the Springfield Police Department at a time where CAHOOTS was operating, saying, we're worried about our child. Our adult child is saying that they're really fearful that they're going to be killed by police. You're seeing a real deterioration in mental health, and we need to do something different because we don't want this to end up in her death. And what happened was Sergeant Rick Lewis, who was our liaison with the Springfield Police Department, described himself as being the mental health guy within the police department. The one who pulled the trigger did so after Stacy had pulled over her car, not because she was being pulled over, but because she saw a Springfield police car behind her. She pulled over, threw a small kind of dollar store noisemaker out the window, and then started to drive a little erratically. 2 more stops later, her car was pitted, and within a minute, she was dead. Sergeant Rick Lewis broke through the passenger window of that car and fired 3 shots. When he hurt his wrist and got some abrasions, he received a Purple Heart commendation. A year later, the Springfield Police Department had to pay out a $4.5 million civic settlement to the Kenny family as a result of the findings of the investigation related to this. So when we talk about how this reduces police violence, we also have to recognize that it takes police departments getting these systems involved and allowing them the opportunity to do the work that the community is asking them to do if we are going to be able to save some lives. So that's I think a heck of a punctuation point to kind of end my spiel on, but it's really, I think I can't underscore it enough. CAHOOTS alone isn't going to save any community. And in fact, within our own community, while we are making a big impact, we are still seeing folks die by police when they're in crisis within our own community, so the work isn't done. And we have to recognize that we still have a lot to do here within the Eugene Springfield community, while the rest of the nation is really looking to our program as its kind of gold standard.
Okay, well, thank you very much for that background. And that actually is a perfect segue. We are part of the rest of the nation looking at your program and learning more about it. So I'm sure that there's probably a lot of questions here. So I will, and I see we've been joined by T. Williams, another one of our group. So welcome, T. Okay, I see Lee Munich has his hand raised. We'll start off.
So, this seems like a very impressive program for Eugene, and we're focused on Minneapolis, and I'm trying to think about how your experience how it might apply here. And we have a situation where we have a group of people who are proposing to defund the police department, dismantle the police department, want to change the charter, put it under the city council rather than the mayor. And then we have other people saying, no, we shouldn't do that with the police department. We need to change it. We need to do the kinds of things you're talking about. It sounds to me, the way you're describing it, like this, a large part of the success of the CAHOOTS program is being able to work with the police department. So, it didn't sound, I didn't hear you talking about major restructuring. I wonder if you could comment a little bit more about that. How much resistance was there by the police department? What did it take in order for them to get the kind of support that you've had with the program?
Yeah. I think we had the right kind of mix of public safety personnel when we got this started. It was all enthusiasm. It was really, we have this, and a lot of that I think had to do with because it was grant funded, right? We weren't reducing, there wasn't a direct cut to, personnel or pensions or anything to bring in the program to begin with. So it was very, right out of the gate, it was this additive thing. And what it did was take the non-criminal responses off the hands of law enforcement. And so patrol officers had more free time. You know, they were spending less time talking to folks about housing, doing kind of social service calls, you know, so there was a lot of support for it initially. And I think that had to do with just kind of the climate and the leadership that we had. We compare that to what it was like going to the city of Springfield, you know, trying to do that work, getting things set up in 2014 so we could provide services starting in 2015. It was really challenging. You know, police within the city of Springfield were unwilling to acknowledge that there were homeless folks. You know, so we don't have homeless in Springfield as a response. And I could say, well, I can tell you where all the camps are, you know, because I used to do street outreach in Springfield. So they are here, you know, or these ideas that, you know, you don't need to have food on the CAHOOTS van. You can get 8,000 calories a day and free food if, you know, around town. And that's true if you can teleport yourself to all 4 lunches being provided, you know, get to the breakfast that's 10 miles away from the, you know, the dinner the night before. So there was a lot, there is a lot of potential for, you know, there to be these kind of just assumptions and biases about, you know, the folks who are receiving the care from this kind of service from public safety. It's just not something that we encountered on the scale that I think a lot of other communities will as they're rolling out their programs today.
Okay, thank you. Thank you for that. Okay, I see we have Walt in line. Helen, did you have a technical one or a substantive question?
Substantive question. So,
Okay, we'll put
yeah.
you behind Walt then.
Tim, thank you for an incredibly informative, candid discussion. And I have multiple questions, but let me start with the first one. The funding is going to be a big issue. Because does this come out of the police budget? Does it come out of a public safety? How does Eugene fund the White Bird CAHOOTS program?
Yeah, the short answer is inadequately. You know, the CAHOOTS program has historically run at a deficit because our funders have really allowed us to, you know, get locked into that same kind of funding issue that a lot of nonprofits encounter, right? Where it's about just, we got to get out there and provide the service, because if we don't, no one will. And so we end up taking a lot of the lowest bids. So City of Eugene funds 100% of the services as identified within our contract. That comes out to the tune of just shy of $1 million a year. For our responses in Springfield, there's another $1 million in operating costs that are split between the City of Springfield and a grant provided by Lane County Health and Human Services. But we still have to fundraise about $500,000 on top of that. And we receive about $50,000 a year from Medicaid for wraparound service funding, because we're out there, because we're providing care on any level to the folks that are covered by Medicaid in our county. Medicaid has said, hey, we recognize that you're saving us dollars. So here's, you know, a fraction of what you save us just by being out in the community.
Would you give us a ballpark of what the police budget is compared to the CAHOOTS budget? You said $1 million for CAHOOTS. What's the police budget?
The ballpark, the City of Eugene Police Department budget is $60 million. There are
do 20% of the work and get one money.
Yeah. Yes.
Yeah. Okay.
Yeah. So yeah, and that's where, you know, where we need to really recognize that it is not enough. You know, the most conservative estimate that we have found on our cost savings to the City of Eugene Police Department coming from EPD is that in labor alone, we are saving $1.5 million. That's in addition to the nearly $1 million that gets spent on the program. So by that logic, the City of Eugene has a $1.5 million that could also be going to support the CAHOOTS program. It would allow us to be able to pay wages that are competitive with other first responders. Right now, we pay $18 an hour. This isn't a career job for folks. We can't afford to provide, you know, health insurance coverage to families, you know, of our responders. We can't do retirement plan matches, you know, right? And these are the things that are preventing us from really allowing our staff to stick with this program in a meaningful way that would really kind of create foundation to allow us to expand even more than we've been really forced to, you know, these last few years, especially. So, you know, that question around funding is, you know, the city of Eugene gets a lot of recognition. They get a lot of praise for funding this program. But as we made a direct ask to City Council and the Budget Committee about just this past week, you know, we would like to see some of the fruits of this supposed, you know, endorsement. CAHOOTS was included in a lot of the outreach materials and information about a community safety tax levy. Our picture was the first one on the slideshow when you went to the City of Eugene's website about the Community Safety Initiative tax money. When that was approved and the budget came out, guess who didn't get any of the funding from the Community Safety Initiative? CAHOOTS.
I have a lot more questions, but I got to give other people a turn.
I was just going to suggest that, Walt, but continue to jump in throughout because you've got some very good ones. Okay, Helen, we have you up next.
Thank you. Yeah, thank you so much. And you've already begun to address my question in your response to the last one, but just could you say a little bit more about the way that CAHOOTS saves resources as compared to the way this is handled often by traditional law enforcement? And additionally, what kinds of calls are you receiving that you wouldn't have otherwise had there been no CAHOOTS? And you explained that you don't have necessarily data from or digital data from pre-CAHOOTS, but just a little bit more about those dynamics would be great.
Yeah, you know, kind of thinking about the idea of what is it that we're responding to that wouldn't have gone to, you know, police if we hadn't been there, is a really good question. And I think a lot of it is kind of the lower acuity mental health stuff. It's a lot of our work in prevention, being able to go out and talk with somebody when things have first started to escalate for them, you know, gives us this really amazing opportunity to come in early before it's gotten to the point where you have a dozen neighbors calling and asking for police to come out because it's become a huge issue, right? You know, being able to reach out to us when you experience that, you know, when you first experience that shelter insecurity, you know, it's our ability to come in before things have really gotten out of hand that has, you know, allowed us to respond so often. You know, I think some of the situations that, you know, we handle that are within that are, you know, really about getting folks connected to services. You know, that's not something that an officer would really be able to even take the time to do. You know, a cop can take you to the hospital or jail. That's really kind of about it, right? You know, but we can take you to, you know, McDonald's and get you some food if that's what's really going to make the difference for you that day, right? You know, we can take you to where the shower and laundry is. You know, we just have a lot more options at our disposal. And that means that folks can call us a lot more frequently for situations that wouldn't, you know, get a response from the police or the fire department. There is also, I think, a recognition that CAHOOTS ends up kind of filling in a lot of the gaps for public safety across the board. And so when things get really messy and police are having a really busy night, who is it that they send out to go do those area checks for somebody shouting? It's sending the CAHOOTS team out because we can go out, we can get eyes on something and then get on the radio and say, no, this really does need police response, or, you know, there's nobody here, or even better, we found the person shouting and we helped them and it's not going to be an issue for the rest of the night tonight. You know, so there's a, yeah, I guess, you know, our flexibility, our resiliency, and the ability to respond to these situations out in the community before they've gotten more escalated, you know, is really a result of the direct collaboration and our outreach, you know, really making sure that folks in the community know that they can call us, you know, for these situations, right? You know, it's really hammering local media, having first name, you know, being on a first name basis with the reporters in town. You know, that's doing a lot of that, you know, direct outreach is what has allowed us to get to this place where folks trust us and call us in, you know, before things have really gotten out of hand.
Right. Wow. That's incredibly valuable. Sounds like. Well, okay, we have Clarence in line and then John Adams. And then I want to put myself in at some point too.
Sure.
And Paul Oscar, you're going to be heading out. So you jump in if you want to. So, okay, well, we'll go with Clarence, but Paul, jump in if you're going to need to leave soon. Okay.
My question sort of follows up on what Walt had asked about. When I hear what you try to do or you do with various people, it sounds as though it's a significantly a dimension of the mental health activities of the community. You started by saying, hey, in response to deinstitutionalization, we have all these problems. Then we had the drug consumption went up and all kinds of behaviors became an issue for the individuals and for the community. And The question is, who in the community is visioning the mental health, drug-related response questions in a way that is their responsibility? I mean, we have the police kind of responding to 911 calls, and now we're diverting, I guess, 10, 15% of them. But what's going on in the mental health issues with respect to the area? Because it seems to me, what you're telling me, is that overwhelmingly this is, like a number of other things, question for the mental health world in that area.
Yeah, yeah, Clarence, you're totally right. We are really operating within the public health, sphere, and to that extent, a lot of the local initiatives are being driven by the funders, and so that's where we see Lane County Health and Human Services playing a big role, both with their own grants, but also as the facilitator of state and federal dollars. We, outside of the county health and human services system, the county behavioral health, there is a really strong coalition within our service providers. Those agencies and organizations that are addressing mental health work together on a regular basis. There are ways to, facilitate collective impact. There have been shared funding for initiatives in the past. And so, I feel really fortunate, honestly, to be part of such a strong network of providers within our community. That doesn't mean that we've got it figured out, or that we are treating everybody. There is still inadequate resources, even with the robust system that we do have in place. And so, really, we have a lot of really good support from our county behavioral health and county health and human services. But we also have been afforded opportunities as the providers in our community to really help guide a lot of what treatment, and what resources look like for our community. And that is all because, we have those direct relationships and are really working to create community informed services.
What's the budget of the Lane County Behavioral Health activities?
I will have to find that out and get back to you with it.
Because that's really key. This is key, this discussion.
Yeah.
We focus on the cops and on the police department, but it looks to me as though it's really a dimension of a much bigger thing called maybe public health, maybe behavioral health. I don't know what the label is, and I don't know where the money's going to come from, but it's a much bigger picture.
Absolutely. Yeah. And that's one of the big conversations that a lot of communities are really wrestling with right now is where do those dollars come from?
Right. There's a lot invested already. That's my point. There is an awful lot invested. Question is, how much more is it going to be, and who's it coming through? Where's the funnel coming from? Is it coming largely out of the municipal budgets, or coming out of the county and or state or federal budgets?
Yeah,
I mean, we've had an absolute avalanche of money coming out of the federal government for COVID related stuff that could be spent in all kinds of ways.
Yeah, and that's where I'm holding on to some optimism around the CAHOOTS Act and Congress right now. The CAHOOTS Act did receive a kind of a down payment in the American Recovery Plan, of some dollars being set aside. We need to figure out, and I'm excited to work with Senator Wyden's office and others who are part of this process to really kind of develop the rules, regulations, and standards for how that money is then going to be rolled out. But that's one funding stream. It might not work for every municipality, and so I think we need to really look at multiple potential options.
In cities area, and I suspect it's true throughout the country, the main recipient of and the main responsible organization for the delivery of public health services, behavioral health services, all kinds of services, happens to be the counties, not the cities. The really big operator is the county, and that's true here. I mean, that's where it comes from. Mm-hmm. And I don't hear a lot about that in this discussion. It's sort of like this municipal issue. And it's really much more, it seems to me, a county and or state issue. And then there might be other strategies for how to deal with all this, this particular population. And the population is a mixture, as you point out, between those who are seriously mentally ill with a diagnosis of schizophrenia and or bipolar, to those who are addicted to various kinds of substances, increasingly drugs as well as alcohol. And then we've got the people who are mostly men on the streets and they're homeless. Now, those are the populations we're really talking about.
A complicated picture.
Yeah,
but it is a picture that don't forget the county's role in this thing.
Mm-hmm.
Very true.
Could you fill in just a little bit more about the CAHOOTS Act? And I think we already said this, but in case we didn't, tell us what CAHOOTS stands for.
Yeah, so CAHOOTS stands for Crisis Assistance Helping Out on the Streets. It's a clever acronym that my founders came up with. The CAHOOTS Act is intended to use Medicaid block grants to, no, excuse me, not block grants, is to use Medicaid to fund up to 85% in a matching grant for the first 3 years of mobile crisis services. This is really about helping provide the resources to get these programs through the pilot phase, where cost savings can be recognized, whether that is at a city level or at a county level, and start to really kind of reallocate funding from wherever, you know, a community places its values and priorities around finding those dollars. You know, so it's really kind of about kind of that kickstart, get things out of the gate, you know, sidestep a lot of the conversations around, well, we can't afford to do this, so we're not going to, you know, or we can't afford to do it well, so we're going to do this kind of watered down thing that is just a road to failure, right? This is really, you know, feds kind of taking the role of saying, like, here's the money, here's how this money should be spent, and then get out of the way and let the programs operate.
And hopefully will lead to a lot of innovation and
Yeah, fingers crossed.
hope. Okay, well, Walt.
I think John Adams has a question.
Yeah, John Adams is next, and then Paul Astro.
Tim, the University of Oregon forms a pretty significant share of the city's population and economy.
Mm-hmm.
And here in Minneapolis, we have some tension between the Minneapolis police and the University of Minnesota police. What kind of parallel situation might exist in Eugene with regard to both policing and human services and crisis intervention?
Yeah, it's been really hard for us to honestly to break through and build the relationships we would like to with the University of Oregon, which is really frustrating because, you know, when you go back and look at our founding, a lot of the, you know, early members of the organization were directly tied to university, you know, maybe professors who were also providers with us. And so it's, you know, it's been interesting to see that shift happen. And, you know, I think a lot of folks would have a lot to say about the cultural shifts at the University of Oregon as you know, Nike has become such a strong supporter, and a lot of the focus has shifted to, you know, athletics with track and field and the football especially. So, you know, with regards to the university police and other services available on the campus, it's generally been our experience, and this is something I experienced when I was the administrator of the CAHOOTS program, was that there's this kind of tendency to say we have our students handled, right? You know, we've got our transportation, you know, the van they can call to get back to their dorms if they're stranded out somewhere in town. You know, we have our crisis line. And so it's been, you know, really challenging for us to get in and have the kinds of responses that we would like to on campus. You know, it's within kind of the residential settings there. Once you start to work with students who are living off campus, they're calling us a lot, you know, because they're more within the jurisdiction of the Eugene Police Department. So we see the students calling us a lot, but really it's kind of the institution itself, the University of Oregon, where we haven't really been able to kind of break the barrier there. If we were to engage more directly with UOPD, I think we would also want to see them at the table as a funding partner, right? You know, because that would be another jurisdiction that we would be operating within.
Okay, thank you. Well, okay, Paul Astro, we get a question before you have to head out.
Thank you, Janice, and thank you, Tim. And yes, Tim, I unfortunately have another obligation at noon. So I'll try to get my question quickly, but I've been a bit concerned about a false narrative. You know, we're studying these issues in large part because of the murder of George Floyd and the tremendous concern about police misconduct. And I'm just wondering if that's a false narrative. And as it relates to your program, I don't want to misunderstand what you said, but it seems like that, I guess would like you to comment on this, that the better way to look at your program is it's a better way to serve people, that people in need are getting the right kind of services, that they're getting better access to services. It's freeing up law enforcement to do those things that law enforcement should do. But if the goal, it doesn't sound like the goal of it is just let's reduce the contact of police with these people, and then we'll have few people shot. We'll have fewer people that'll be victims of police misconduct, if I can be so blunt. And it seems to be that second piece of it that everyone's focusing on is, and maybe what we need to focus on is what Walt has talked about is the police themselves and how they approach these situations. But I just would like you to comment on it, because I kind of sense from you that while the program is very successful, it doesn't sound like you would hang your hat on the notion that you've reduced violent confrontations between citizens and police. Doesn't sound like that's what you would point to as your number one accomplishment.
I mean, I think it's obviously, it's really complicated. When the program was started, no, it was not built as this force to reduce police violence. It was really recognizing that there was something missing from the larger response system, and that by including this response, we would be reducing, jail time and hospital visits. And when George Floyd was murdered, and I saw that footage, I wasn't thinking, hey, this is going to turn into one of the busiest years I've ever experienced at work. But what happened with George Floyd's murder and, Breonna Taylor, those situations, CAHOOTS, if we had been available in those communities, we would not have saved those lives. Those had nothing to do with CAHOOTS, right? A no-knock warrant in the middle of the night is not CAHOOTS territory. Going to talk to somebody about a counterfeit bill, that's not CAHOOTS, right? But those situations really open a lot of eyes in the country and started to ask questions about what else was it that police were responding to that wasn't appropriate. It's true that folks experiencing mental illness are 16 times more likely to be killed by law enforcement than those without a serious mental illness. And so we can't talk about police violence without talking about police responding to mental health calls. We can't pull these issues apart. And in fact, this last year of profound social movement and unrest has really allowed us a lot of opportunity to ask these questions. And when we start to look at what would a world look like with fewer police or with no police, we have to talk about what would be there instead, or for some folks, what would be there in that transitional phase. And so that's where we see CAHOOTS come in a lot of different conversation, in a lot of different political spheres. Those who want to see complete abolition really see CAHOOTS as being a part of having other types of responders available. There was a point in time where when you had a medical emergency and you needed to get to the hospital, it was a police car or the local morgue tossing you in their hearse and taking you, right? It wasn't until the NAACP's Freedom House in Pittsburgh started to really create a response for Black neighbors and then eventually expand that out, that we developed what is now the EMS system that we have nationwide. And, by no means am I drawing an analog between the NAACP and the Freedom House and Whiteburg Clinic, but I do think we are at a similar inflection point where there is this need for another type of first responder, oriented around behavioral health, addiction, and socioeconomic issues that just doesn't exist on the kind of scale that we need it to right now. And, the conversation that reform initiatives around that really got a kickstart because of all of the different initiatives that we've seen taking shape over this last year.
Thank you.
Okay. So we'll move back to Walt. Oh, and actually, before we do, Tim, I should ask, what is your time available today? We don't want to, we're really appreciative and don't want to intrude on.
Yeah, I can go. I
available.
Yeah, I need to wrap up, within a few minutes of I guess 10 o'clock my time, noon your time. So I've got about 10 more minutes.
Oh, 10 more. Okay. Yeah. Well, thank you. And we'll thank you at the end also. And move with that time constraint in mind, we'll move on to Walt, because I know you could keep him here literally all day.
Yeah. Good. I have a couple of questions. First, does the University of Oregon have a criminal justice department where they train law enforcement?
Yes, there's a criminal justice major at the
and they don't talk to you?
No, not enough.
We
talk. Yeah, we talk. Yeah, we talk with Health and Human Services programs at the University of Oregon.
Right. I can
yeah. But no, not the CG stuff. Yeah.
This sergeant who shot the mentally disturbed woman, who thinks he's a mental health responder. Obviously, he is both arrogant and ignorant. We got a lot of those in our police department. How are you going to deal with that? And more generally, if you were going to advise us, blind, of course, how would we get this set up? Your story of how this organically evolved is just powerful. It's the same kind of accident that brought about the total police approach difference in Camden. You don't have that. You have to make those things happen when they're not organically happening. Do you have any advice for us? And part of that is, how do you train a police department with a sergeant like this?
Yeah, and
I guess.
Yeah, and when we figure that out, we will tell folks what has worked has been continuing to show up, and really recognizing that reform only happens when there are those of us who are willing to get into the middle of things where it is least comfortable, where there's the most dissension and disagreement, and try to make change. And so what we had to do was go in, every couple of weeks when we had those meetings and sit down and be like, we need to do this differently. We need to be able to respond to these call types without your police showing up with us. We need to know that when somebody is calling for CAHOOTS services that they are getting them, and if those things aren't happening, then we are going to go to those who sign your checks and bring this up with them. And so that means that we don't need to have a relationship just with the police department and just with those Sergeant Lewis's, but with, city managers, right? If there's a police commissioner, then you need to be in touch with them. But it needs to be community members who are really leading this process, no matter what shape it takes. What we really see in other communities that works well is when you provide enough seats at the table for lived experience to take the majority in every aspect of planning, implementation, and then ongoing support. That means folks who have lived experience with homelessness, with police violence, with the mental health system, with addiction, with poverty, right? The folks that are receiving that care alongside the providers. And then maybe if you have room, you bring in city manager and a couple of, city councilors and some folks from the police department and, public health and all of that. But anything that another community is doing really needs to be centered in the lived experience of the impacted populations that you claim to be helping with these types of initiatives.
That's profound. Okay, I see T. Williams. I was just going to say, anybody that doesn't want to use the hand raise button, wave vigorously. Okay.
Yeah, I'm sorry that I am so late getting here, but I did have an opportunity to review some of your material. But my question relates to your startup in terms of what kind of research, for want of a better word, what did you do? What kind of information did you gather about the problem that you were facing, and to what extent do you look elsewhere for what others were doing with similar kinds of issues, or also did you have an opportunity to look back at what your experience had been in your community about it? And I ask that question because some of what we are struggling with here, at least with my experience with the city council, is that they are not looking at what the experiences we have had here and what has worked and what has not worked. And it seems as if we're starting from scratch, and that we have 2 or 3 people who assume that they have the answers to it and sort of close out other kinds of information. But we tend not to look to our own history of what has happened to inform us as to what to do or what not to do.
Mm-hmm. Well, when we were getting the program started, the information that we were looking at was, a lot around police call data. What were the times of the day, days of the week where police were going out for a lot of these kind of quality of life misdemeanors, the open containers, the trespass to, disorderly conduct. And that was compared and contrasted with the difference between presenting problems and situation found. You know, we couldn't just look at what the calls were coming in as. It was really what was it that officers were encountering when they arrived on scene. And through that evaluation, we really understood that it was kind of the latter half of the week and in the evenings where there was going to be the most potential utilization of the CAHOOTS service. And that was, again, you know, kind of looking at what was coming in through the dispatch system, what was actually happening when officers got out there on scene, and questions around kind of what responses CAHOOTS would facilitate were addressed by community members saying, this is what we want to see out of this service. If we were to do that today, if we were to get started today, I think we would really prioritize a lot more of that community engagement. The questions that we were asking the community in the 80s were a lot more kind of one-on-one. You know, Whitebird Clinic was a small organization. Chances are you worked for a couple of departments. And so maybe you were involved in some of the planning conversations for CAHOOTS. And so then you would just, in your counseling session, be like, hey, Whitebird's going to do this mobile crisis thing. What do you think about it? We didn't do a very good job of really creating structured and consistent, accessible opportunities for large-scale community engagement, you know, large-scale stakeholder panels or approval process. And so that's something that we would really encourage, you know, other municipalities and communities to look at today, whether that's on a city or a county level, is really, you know, centering this in the lived experience, you know, of community members.
Yeah, we have had an experience here back in the late 90s, early 2000s with community policing under our NRP program. And I have yet to have anyone who is involved in this, what is currently happening, make any reference to what that experience with community policing was like. Were there any successes, and what happened to that, to it? And I think that there were some findings that came out of that that could be of some value to us now, but no one seems to be looking at what our experience was here in Minneapolis with community policing.
Mm-hmm. Mm-hmm. You know, yeah, it's when the funding became available for CAHOOTS, half of it went to us and half of it went to a more traditional kind of community policing setup where you had officers that were assigned to foot patrol beat in downtown where most of our activity was happening. That approach is still a large component of the Eugene Police Department today, and are the officers that we have our most frequent interactions with, most frequent collaborations. And so whether or not it has been successful, I think that depends on whether or not you have experienced the policing end of that community policing, or if you've been more on the community side of things. I would argue, based on my experience talking with community members, that generally it's helpful to know the names of the officers, but that means you're on a first name basis with the ones that are arresting you on a regular basis.
Mm-hmm. Okay, I see Clarence has a question, and I want Tim, I want to give you a few minutes to wrap up at the end and just
sure
address anything that we've overlooked or haven't asked you, or you'd like to add after the conversation.
Definitely.
So be sure you cut us off and give yourself those couple minutes at least.
Yeah, definitely.
And our deep thanks. Just very
absolutely
great that you were here, and thank you for your time and this interesting.
Invaluable.
Thank you. Okay, Clarence.
Well, one of my observations is that, and I don't mean to disparage anything, but there's a lot of discussion of sorts going on in this community and others that is being stimulated by a group of people who are, quote, professional community organizers. Mm-hmm. There is a set of theories, there's philosophies, there are activities that people who are community organizers engage in, and they have a certain philosophical disposition that's different from the people in the healthcare industry and different from the people who, quote, run city or county or state offices. Could you comment about that? Because a lot of the terminology you're using is about the community and about the people who are affected at the table, basically making the decisions, that kind of thing, which is a fundamentally different paradigm than what we've got in place in the public sector.
Wow, that's a tremendous question. I think you're right. There are a lot of differences, between the way that we talk about doing this and the way that a lot of, organizers, a lot of community members want to see it happen. And it reminds me a lot of a conversation that I had with Portland City Commissioner Joanne Hardesty about the kinds of pressure that it takes to be a successful, elected official, and that it requires a lot of constant external pressure in order to do your job well, to know what your community is thinking, and to be held accountable for your missteps. And what Joanne really described was needing those folks who were saying you're never, who are always saying you're not doing enough, or this is the wrong approach, because it meant that there were folks who were willing to engage with her, that wanted to look at what was going on in the city and cared enough to speak up about it. There is always going to be disagreement, and there is always going to be tension, and there's always going to be a need for compromise. We had a petition here in the city of Eugene to reallocate a third of the Eugene Police Department's budget to CAHOOTS. That wasn't anything that we authored. It was an online petition, but it got 15,000 signatures. And what that did was really punctuate the fact that the community was calling for increased financial support of the CAHOOTS program, and saw that the city was trying to take credit for something that they were underfunding. And so it's really about finding alignment within that disagreement, within this diversity of approaches, and saying, we're never going to get this right for everybody, right? But we are working hard, and we're going to make the space for those voices to be heard. And, for all those community organizers, I would really encourage them to take a moment to really reflect on whether or not they are taking time to celebrate the successes and recognize when there is, effective progress, or is it this going to be a constant moving target of this wasn't good enough, and now because you're involved with this other thing, that's not going to be good enough either, right? There's going to be tension, and I really think that we need to figure out within each of these communities, on whatever scale, how we can operate with that tension and use it for something productive, rather than continuing to kind of just go back to our own corners and fight with each other.
There's a big evolving, developing story here that's not getting covered by the national press or by anybody, and certainly not in the think tanks of the universities and the various departments that might be stimulating the production of people who become community organizers. I mean, I don't hear any real discussion going on in any of this arena about any of this activity, and yet it's a very real thing, certainly in the Minneapolis area.
Yeah.
And I suspect it's going on all over the country, and they're communicating with each other by social media, and it's a very major thing. But everybody seems to be either wanting to ignore it or they don't know how to deal with it. It's an enormously big story.
All right. So, Tim, it's just fascinating. It must have been the most amazing last year plus for you.
Yes.
But I appreciate your being here and sharing your time with us and your thoughts. And I'll give you a chance to wrap up. And if hopefully we have covered a lot. And just add any last thing you can.
I think I think a final thought would just really be to really reiterate that this isn't a cookie cutter program, that this isn't a one size fits all thing. What we have has been really something that's shaped and informed by the communities of Eugene and Springfield. And that's something that when we have the opportunity to connect with other communities, at whatever size or scale, is really reflecting back that this is something that needs to be designed and informed and held accountable by your community. And that there are going to be differences in service delivery. There might be differences in staffing or what supplies are on the vans. And that's really a reflection of the needs of each area that these teams are trying to serve. The other thing I would really point out, this is something we say a lot in our press releases and in the presentations that I and my colleagues do, is that CAHOOTS alone isn't going to save Eugene or any other community. This is one component of larger systems reforms that need to take place. And there are a lot of stakeholders, a lot of key players that need to be brought in. None of them are going to walk away from this with exactly what they wanted, right? But we really need to look at the larger picture and look at the other things that are going to need to happen. There's this assumption that in a lot of communities that you just bring in the CAHOOTS-style team for your city or your county or whatever, and it's going to be great. And there's no real recognition that the fact that CAHOOTS is able to achieve the kind of cost savings we do, $15 million in savings to the ER and, reduced ambulance rides, which is a whole other hour-long conversation. There's not a recognition that our ability to do that is because we can take somebody directly to sobering without getting police involved, that we can de-escalate a lot of these situations and get folks connected to other resources. And so sometimes when we talk to a community, what they walk away with isn't, okay, now we know how to do our thing. Here's our roadmap to our CAHOOTS program. We're not right. It's a recognition that maybe they're not ready yet. And maybe they need to focus on building that crisis center and access to services, being the focus before you start to bring in that mobile crisis team. So I guess that's what I would wrap this up with. I really appreciate a lot of the questions and the challenges that have been raised, and I'm grateful that I have some research and some new things to really consider as I continue to talk about this in the future. So thank you all, for this time.
Thank you.
Yes, thank you so much.
Thank you.